My name is Michele Ashton. I am an OBGYN physician. And that means what I do is I'm a doctor that takes care of women's reproductive health. So we take care of women while they're pregnant, care for women and their babies during the pregnancy, deliver babies, do C-sections, and I also care for women when they're not pregnant about things having to do with their reproductive organs, periods, cancers of the reproductive organs, period problems, menopause symptoms, PMS, all kinds of stuff like that. So I work in an office up here in St. Joe, and I take care of women throughout their whole lifetime. And one of the things I'm going to talk with you about today, I'm going to try to hit on two big categories of things today, which I've heard you've already learned quite a bit about some of these things. And that is birth control, which maybe you haven't learned about too much in class yet, and a little bit about sexually transmitted infections and some of the best ways to prevent them. These are things I talk about all day long to people in the office, you know, with their particular situation in mind, but I don't usually sit and talk to a group of people like this. So I'm going to give you a whole bunch of information. I sent the PowerPoint presentation to your teachers too. So if you think of questions, want to look back at that later, you're welcome to refer back to that anytime. And if you guys think of questions as I'm talking, feel free to raise your hand and we can answer stuff as we go along. And then, you know, I didn't tell you this with your other class too, Jamie, but whenever after I'm done, if the students have questions or you guys think of stuff you're not sure, you want a clarification on, feel free to email me and I'd be happy to answer any questions.
Okay, thank you.
All right, so I'm going to share my screen here to show you guys, instead of my face here, what we've got for contraception. All right, so when you hear the word birth control, what kind of things come to your mind?
She's asking that question. What comes to your mind when you hear birth control? Someone just go ahead. The pill.
The pill.
Anything else?
I mean, like preventing getting pregnant.
Yeah. Preventing getting pregnant.
Good.
Anything else? Okay, the pill once again.
I got it. Okay.
Wait, I got one more. Yeah.
I think about like when women get their tubes tied.
Okay, so surgical. Okay, tubes tied.
Perfect.
Anything else? Yeah. IUDs.
Okay. I love it. You guys are way more awake than the 8 o'clock. You guys weren't so awake at 8 o'clock either. Maybe that's the difference. All right. Perfect. Those are all excellent answers, and it's good to know kind of where we're starting from. I would say what your guys' answers go right along with, you know, for some reason I'm having trouble seeing the screen of you guys and my screen at the same time, like I could last time, but yeah.
Your screen hasn't been shared yet with us.
Oh, it hasn't been. Oh, well, that's the problem. I thought it was. Okay, there we go. There, I just needed to make one more click. Okay.
Yep, there you go.
Oh, good. So, perfect. Birth control, most people, you know, in America, anybody that I say birth, or if someone is talking to me and they say, I don't like birth control, usually they're talking about the pill. Just like you guys said, kind of the first thing people think of is the pill. And like someone else said, very good, the whole purpose of what birth control is preventing pregnancy. But there are many other methods of birth control, like you guys said, permanent sterilization, like having your tubes tied, or things like the IUD. So I'm going to cover all that stuff and a couple of other things. And your teacher also told me that you guys have recently studied the anatomy of the female reproductive tract and the male reproductive tract. So you're going to be familiar with kind of how this all works. And then also that you learned a little bit about sexually transmitted infections, which I'll talk about some more at the end of our time. But if anything doesn't make sense to you, just wave your hand at your teacher and she'll interrupt me, okay? So what is birth control? Contraception. The word contraception means against conception. And conception is the moment where a sperm meets an egg and a new life begins. So when you're looking at these drawings, whoops, like I said, you guys would be real familiar with these pictures. This is the uterus. This is an ovary that releases an egg, once a month. And all these little things are sperm swimming there that have been deposited in the vagina and swim through the uterus, through the tubes out here to meet the egg. If the sperm happened to be there at the day that the egg is released, the sperm and egg will join, like this picture right here. That's called conception. And that's the moment that an original new individual is formed, different than either of the parents, unique DNA, half from the mom, half from the dad, okay? Conception, so that's what conception means. And here talk about that. So a couple different ways to categorize the types of contraception, and I'll use the word contraception and birth control interchangeably here today, because they mean the same thing. So one way to categorize contraception is by hormonal, which means it contains hormones, or non-hormonal. So the hormonal are all things that would be prescribed by a physician or a nurse practitioner or a PA, and they're things that contain estrogen and progesterone, like the pill or the patch or the ring, or there are some kinds that only contain progestin, which would be the IUD. There's an IUD that's an example of this. The birth control shot called DepoProvera that you might have heard of. And then there's a pill that's only progestin and an implantable birth control that goes underneath your skin in your arm. There are non-hormonal types of birth control. Those include things like condoms, spermicide, those you don't need a prescription for, of course, a diaphragm, which is given by a provider, copper IUD, surgical sterilization. That's what someone mentioned, having your tubes tied as a woman, or men having a procedure called a vasectomy. And that's a permanent birth control. It means from the time you have that procedure done for the rest of your life, you cannot bear children or father children. Fertility awareness and abstinence. Abstinence means not having intercourse. So if you never engage in the behavior that can lead to pregnancy, you don't get pregnant. Fertility awareness is can also be called the rhythm method or the calendar method, and that's just paying attention to the woman's cycle and avoiding the most fertile days of her cycle, avoiding having intercourse then, or being certain to use a barrier method like condoms during those fertile days. Another different way we can categorize contraception is how long it lasts. So there are short-acting contraception, which means they need, daily, weekly, or monthly, or every couple of months use to still be effective. There's long-acting but reversible contraception, which are things that last for a number of years, but they can also be reversed and removed sooner than that. And then permanent contraception would be sterilization, like we're just talking about, tubes tied or vasectomy. So how well does birth control work? Oh, see, I only gave you the hint for a second this time. All right, in the class now, I want to know what you think about how effective birth control is. So we'll start with the pill, which is the birth control that you've probably heard of the most. If you take a pill perfectly, how effective do you think that is for preventing pregnancy? What's the effectiveness of a birth control pill? Raise your hand if you think the birth control pill is 75% effective.
How many of you guys think it's 75% effective? Raise your hand. Okay, you got about 3 people.
Got a couple. Okay, raise your hand if you think it's 90% effective.
90%? Raise your hand. No one is.
Nobody wants to commit now. Oh, you know what? That's because I may be asking it wrong. Well, who thinks it's less than 75% effective?
I got 1, 2, maybe.
Okay, so less than 75, 90%. Okay, who thinks it's 95% effective?
Hey, you got about 1, 2. They look pretty clueless.
Trickling in. Okay, and who thinks that a birth control pill? Who thinks a birth control pill is 100% effective? If you take a birth control pill, you cannot get pregnant. Raise your hand if you think that.
Anyone? Nope, no one.
You guys are too smart for that, aren't you? Okay, so you know the answer on a test is never always or never, right? That's you're experienced test takers. So what about 99%? Who thinks a birth control pill is about 99% effective?
You got about 6 to 8 kids, 7. Yeah.
Okay, because you're getting ready to commit. Okay, well, those of you that said about 90 to 95 to 99 are all correct. The birth control pill, when we talk about contraception effectiveness, there's 2 different numbers that you need to know. One is the perfect use of that contraceptive method, and the other is what we call typical use. So there's perfect use when you study it in a lab or in a research protocol where everyone is, shows up and gets the medicine exactly the way they're supposed to. And then typical use is when you have real people in the real world that are using this and you see what their pregnancy rate is. So with birth control pills, that's this top line here, combination hormonal contraceptive. The effectiveness is usually quoted between about 99% for perfect use and more like 91 to 95% for typical use, okay? But what's important to understand with this, so 99% effective sounds pretty good. If you got 99% on a test, you'd feel pretty good about that. But when you think about birth control failure or effectiveness, you have to realize that it's calculated based on per year. So if a birth control method is 95% effective, which is probably a pretty realistic number for pills that are used relatively consistently, 95% effective means there are 5 failures per 100 users per year. So that means if 100 people are having sex and using pills as their birth control method, not in their whole lifetime, but each year, 5 of those couples, if they're male-female couples, will get pregnant. So there's about 20 students in your class. So you guys about the same size as the first class?
Yes.
So if there's 20 students in your class, I don't recommend this, but if all of you guys decided to start having sex with a partner that's of the opposite gender as you, and you were going to use birth control pills for your birth control method, in 1 year, the 20 of you in your class, 1 person would become pregnant or would father a child. And then that would be same would be true each year. So that's a 95% effective birth control method. Okay. The other thing, did I hear a question or just?
What was that?
No.
Okay. Yeah, nothing.
Okay, all right. So then comparing that to no birth control at all, no contraception, just sort of the average baseline pregnancy rate in couples that are not using contraception is 85% of them will become pregnant within a year. So the contraceptive effectiveness of no contraception is about 15%. So it's a kind of a weird way to think about it, but just so you know, you're not really comparing, that's where these numbers come from. So looking through this list, again, the combination hormonal things include birth control pills, patch, NuvaRing, that's its effectiveness. DepoProvera is a little bit more effective, only 0.3 to 3 failures per year per 100 users. Nexplanon is the implantable birth control, 0.2% failure rate in a year. IUD's failure rate is less than 1%, also about 0.5%. The failure rate of birth control of just using condoms is between 3 and 15%. So that means that people that are relying on condoms only for contraception, for preventing pregnancy, 3 to 15 out of 100 couples would get pregnant within a year. Spermicide by itself is not super effective, only about 25%, 75% effective, so 25% failure rate. More often than not, the spermicide is put with the condoms. And then sterilization is having your tubes tied or the vasectomy. Quite effective, but even that's not 100%. So of course, these things can be used in combination with each other. So if you use a birth control pill and then you also use condoms, then there's that increases the effectiveness, having multiple methods. All right, I'm going to go in detail of these different combination hormonal methods. This is how they work. They prevent the they prevent ovulation. So ovulation, go back to my first picture here. Here's our egg getting released. Here's our egg getting released. And if the egg is never released from the ovary, then the pregnancy can't happen because the sperm there's never an egg that comes out to join the sperm. So that's how they work. They also have other health benefits such as improving menstrual cycles. We use these to treat heavy bleeding or painful periods or irregular periods quite a bit. And they can decrease your risk of ovarian and endometrial cancer. They have no benefit or cause of sexually transmitted infections. They don't prevent them or cause them. And the one medical risk with these birth control methods is that anything that contains estrogen increases your risk for blood clots in your veins, which are also what cause strokes or blood clots to your lungs that can be life-threatening. Super rare, but more common with the hormones than if you're not taking them. And even the risk of blood clots, for example, is even higher in pregnancy compared to when you're using a birth control pill. But they're still really rare things. But it's important to know about your family history. There's certainly things that predispose people to blood clots, and we would avoid estrogen in those people. The birth control pill requires you take a pill every day, take it at the same time every day for it to be most effective. It's less effective if you miss pills, if you're late for taking your pill, or some other medications sometimes interact with it, like a couple of antibiotics can sometimes make the birth control a little bit less effective while you're taking that antibiotic. And women who are overweight and obese, the heavier you are, the less effective the birth control becomes. The patch, the same medicine that's in the pill, except it's just a patch that you wear on your skin and you change it once a week. Otherwise, works the same, has all the same side effects, similar effectiveness, except if it's easier to remember once a week instead of every single day. And then it's specifically only FDA approved for women that are under 200 pounds. The ring is called Youre is the brand name of one of these vaginal rings. They also have a generic of it now. But it works, it's the exact same hormones that are in a pill, except instead of taking them as a pill by mouth, this little flexible ring, it's real squishy, flexible kind of rubber plastic ring you put inside your vagina, similar to putting in a tampon, and it sits inside the vagina you change it once a month. So you don't feel that it's there. It just has that actual ring has the hormones on it that get absorbed through the skin of the vagina. Otherwise, the same side effects as the pill and the patch. And, oh man, it doesn't like it when I use that arrow. Hold on. It's thinking. Okay, the next thing.
Listen.
Let me try to remember what's my next slide. I don't think there's any more combination. Yeah, oh, here we go. So the next, oh yeah, and then this newer, the vaginal ring, yeah, same thing. You change it once a month, and it is, and this newer one is called Anovera. It works the same as the Nuva ring, except this is a reusable ring. So you keep the same ring for a year. You wear it once a month, you take it out once a month to have a period, or once every 3 months, and you wash it and put the same ring back in. Then we're going to switch now to the progestin only. These are still hormones, but this is only one type of hormone. The progestin does not have the blood clotting side effect risk like estrogen does. Estrogen sometimes causes some nausea, and then progestin doesn't do that as much. So that's the reason you would choose a progestin only. The thing about the progestin only ones is that they don't regulate your menstrual cycle. So women that are taking, one of these methods will not have a predictable once a month period. They may have no periods at all, or they may have kind of unpredictable spotting. The effectiveness of this, it kind of depends on which method we're talking about. So we'll look at them. The DepoProvera shot is an injectable birth control that you guys might have heard of. It's a shot that you get every 3 months, and it works by preventing ovulation. It's a very powerful preventer of ovulation, the same as a birth control pill does. And so that's how it prevents you from getting pregnant. Most people, especially after a while on the DepoProvera shots, stop having periods completely. It's really common that it suppresses your periods completely, And prolonged use of DepoProvera can weaken your bones. Estrogen keeps your bones strong, but with the DepoProvera, you don't have that. And so it puts you at a little bit at risk for osteoporosis later on in life. Common side effects with the DepoProvera, I mean, not common, but more common than some of the other methods, would be weight gain and sometimes mood symptoms. Depression can sometimes get a little bit worse with DepoProvera, I would say, compared to some of the other hormonal birth control. Okay, the progestin-only pill, we sometimes call it the mini pill. We use it in breastfeeding women or in women that can't take estrogen for other reasons. It's not as consistent at suppressing ovulation, but there's some other ways that progestin works to contribute to decreasing your chance of pregnancy. And I'll show you on this slide, this picture, what I'm talking about. So the progestin IUD, along with the progestin mini pill, well, the IUD doesn't suppress ovulation much at all. What it does is the hormone here causes the cervical mucus to be a lot thicker, and so that makes it more of a barrier to sperm. It also thins this lining of the uterus called the endometrium, and probably just makes the whole endometrial cavity less friendly to sperm. But it's not fully known all the different ways, all the different mechanisms that it works. I'm concerned that it's not well proven, that sometimes this may prevent a fertilized egg, which begins in the tube, not being able to implant in the lining of the uterus. So there may be some, but that's kind of a gray area. It's just not well understood how the Mirena works. But for that particular reason, I don't personally put these in for contraception purposes because of that. But a lot of people that I know and respect do, because it's not clear how that works. So anyway, but it doesn't consistently affect ovulation, thickens the cervical mucus, thins the endometrial lining, very effective. And these, depending on which brand you get, last between 3 to 6 years. After that time, you can take it out and have a new one put right in, or you can have it removed anytime sooner than that if you don't like it or if you want to get pregnant. The IUD itself may be associated with sexually transmitted infections becoming more severe. So it doesn't cause infections. You would get an infection with something like chlamydia or gonorrhea. You get that from having sex with somebody that has that infection. But typically, chlamydia and gonorrhea cause infections at the cervix right here. When you have an IUD and there's some strings hanging through the cervix, you just have a foreign body in there that's easier for germs to kind of travel up and have that infection spread into your uterus and your fallopian tubes, which becomes a much more severe infection that you often need to be hospitalized for, and it can damage your tubes to cause infertility in the future. So that's true of chlamydia and gonorrhea even without an IUD, but you're just probably a little bit more likely for those infections becoming more severe when you have an IUD. And so I always counsel people that have IUDs to be aware of that. Again, the IUD doesn't cause infections, but you just want to be even more vigilant about trying to avoid infections if you have an IUD. All right, another progestin only is this implant. Nexplanon is the brand name there, and it is very effective. It's something that's inserted, again, at 99% effectiveness. You don't have to remember something every day, but it's inserted in the doctor's office, just underneath the skin of your arm. It's not, once it's in, it's not painful. You can touch it to feel that it's there, but it's not something that you notice or feel throughout your normal life. It releases a progestin that will change the period of the woman. Excuse me. And most women, they have a really unpredictable period. The biggest complaint that people have about this method will be that there's just spotting and no pattern at all to their menstrual bleeding. And again, the advantage of it is that it's long-term and you don't have to remember something every day. And it also doesn't contain estrogen for women that can't take estrogen. Okay, onto barrier methods. So these are non-hormonal methods. You don't need a prescription for, well, you need prescription for some of them, but they don't use any hormones. They're just a barrier that prevents the sperm and the egg from meeting. So these basically work by preventing sperm from getting into the vagina or preventing sperm from getting through the vagina into the cervix and the uterus. Male condoms are probably the most common barrier method that's used. They can be purchased without a prescription. You just get them at the pharmacy. Spermicide can also be used by itself, although it's a lot more effective in conjunction with other things. Many of the condoms have a spermicide already on them in the package, but you can use additional spermicide. Diaphragm here is something that a woman puts inside her vagina, near the top of the vagina, before each time that she has intercourse. And this is sort of shaped like a little cup or a little bowl, and you want to fill it with the spermicide and then put it in before each time that you have intercourse. These are of all the things that we've talked about so far, the one difference now when we talk about condoms is that they do provide a little bit of protection against sexually transmitted infections. All the other contraception methods don't do anything for infection prevention, okay? So they don't make you any more or less likely to get a sexually transmitted disease, but the condoms can make you less likely to get a sexually transmitted disease. And we'll talk before we're done about how much less likely it is. So you gotta think about a condom the way you think about a parachute. So if you guys were up in an airplane flying over your school and somebody said, okay, now it's time to jump out of the airplane, tell me if you would want to put on the parachute most of the times or probably every single time that you jump out of the airplane. So you got to think about the condom that way. You want it to be an every time kind of thing. Used consistently, their effectiveness is somewhere between around 80–85%. The condoms do provide some protection against infections. They can be a barrier to certain infections, but as you guys learned about the infections that you learned about, the chlamydia and gonorrhea and HIV, those are all just transmitted by any warm, wet body surface that comes in contact with another warm, wet body surface. So like the skin of the penis and the skin of the vagina, close contact with those will transmit those infections. A couple of other viruses that I think you already learned about, HPV, the human papilloma virus, and herpes virus. Those are things that can be transmitted even by parts of your skin in your genital area, but that the condom doesn't actually cover. So condoms provide some protection against herpes and HPV in the parts of the vagina and the penis that are covered by the condom, but there's a lot of other parts of your body that can kind of rub together during intercourse that would easily prevent herpes, or that would easily transmit herpes or HPV, that the condom doesn't really give you hardly any protection against that. There are some other kind of condoms. The most common condoms have latex in them. Excuse me, but there are non-latex varieties for people that can't tolerate latex touching their skin, polyurethane, which is just an artificial material, and sheepskin, and there's less data about how effective they are for preventing pregnancy or infections. Less information than we have about latex condoms. Diaphragm, this is just a picture of the diaphragm in use. You put the spermicide jelly on there, and then this is a side cross-section view of a woman. So this is the vagina here, the uterus and tubes and ovary, and this is the bladder sitting in front of the uterus. So the woman inserts this diaphragm inside the vagina, and it sits kind of up at the top of the vagina there. It has to be prescribed by a medical provider because they come in different sizes, so you have to kind of measure for which size will fit and stay in place appropriately. And the diaphragm does not provide protection against sexually transmitted infections the way that condoms do, because again, it's not covering all of the skin that's here at risk for infections. Spermicide, again, comes in a bunch of different shapes and sizes. Not super effective all by itself, but is often used with other things like the diaphragm or the condoms. There is another IUD that's non-hormonal. It contains copper. The copper is spermicidal. Somehow copper causes this inflammatory response that's unpleasant to sperm, and so they just don't get through and don't get out here into the fallopian tube, which is where the egg and sperm meet. The copper IUD can cause periods to be a little bit heavier, and it's effective for 10 years. Something a lot of women who just want to avoid hormones completely will opt for this method. Excuse me. And then just like I said about the other IUD, again, if you were to get an infection right here, see how it's connected to these strings that would connect to this foreign body. So you're just more likely for that infection to spread because obviously your body's immune system isn't working on the foreign body the way it is on your body. Okay, fertility awareness method. I think you guys might have learned about this a little bit in class already. It's basically finding the most fertile time in a woman's cycle and trying to avoid having intercourse then. So this is for a woman with a really predictable menstrual cycle. This can be quite effective. There are several different ways to tell when a woman is ovulating and a lot of different methods of these rhythm methods, fertility awareness, natural family planning. You'll hear a lot of these terms. There's a lot of different ways that women can monitor different symptoms of ovulation to make that more effective. But you have to know also that sperm can survive inside a woman's body at body temperature for up to 5 days. So 3 to 5 days for sure, sperm can last. So you have to avoid intercourse. And the egg is only viable for about 24 hours after ovulation. So once the egg is released, the sperm need to meet that egg within 24 hours, but the sperm can be hanging around for up to 5 days. So usually it ends up there's, without having a real precise day of every cycle being the same, to be most effective, you really usually have about 7 to 10 days a month that you would need to avoid having intercourse for this method to be most effective. And again, the effectiveness depends on how well you stick to your method and how consistent that particular woman's cycle is. All right, then the sterilization that you mentioned, or having your tubes tied, is a term that women will use, or a tubal ligation. What that is traditionally was just removing one piece of each fallopian tube. Nowadays, we often just remove the whole tube rather than just a piece of it. And that has no impact on your periods or your hormones. As you remember from your anatomy that you already learned probably, the ovaries are what make hormones. The uterus is what bleeds each month and has the period. So these fallopian tubes are just kind of the path for the sperm and egg to meet, and removing them doesn't change anything else about a woman's life, except that she can't get pregnant. This picture down here is the male equivalent called a vasectomy. This little tube here is called the vas deferens. It connects the testicles, which make the sperm, into this tube that goes outside of the body with intercourse. Or with ejaculation, and if you separate that, then the sperm can't get through. There's a certain number of sperms stored up in the vas, so after a vasectomy, you have to go back in for a check to make sure that all the sperm have been cleared and that your vasectomy is you can rely on the vasectomy for birth control. Tubal ligation is a surgical procedure, outpatient surgery, but it involves an incision in the belly button, a couple of other small incisions, because again, the woman's parts, of course, are inside. The vasectomy is a procedure in the office, just made by a small incision in the scrotum, much less invasive and quicker recovery, that type of thing. But these are both pretty equivalent effectiveness, 99.3. Again, now that we remove the whole tubes, it's probably closer to this 99.9%. Occasionally, the reason this isn't 100% is that occasionally, these little tubes, as they're healing and the body's scarring process, somehow they find a way to form a little opening to heal back together instead of staying apart. And when that happens, the sperm and egg could get through and get together. Emergency contraception is something that is taken after intercourse to decrease the chances of pregnancy. And neither of these are nearly as effective as any of the other methods that we've talked about. So they're definitely something that you don't want to rely on only. But the plan B is called levonorgestrel. That's a progestin type of hormone. And you can take it up to 3 days after intercourse. And it's most effective the sooner you take it. And it really just kind of depends on where you're at in your cycle. Where the woman is at in her cycle to know, if the emergency contraception will prevent pregnancy from happening. Approximately a 50% decrease in the expected pregnancy rate if you take the emergency contraception. Just know also that the emergency contraception, the plan B, will change will cause some irregular bleeding. So it's really important to get follow up with that to find out if, take a pregnancy test, find out if it worked or didn't work. If you are pregnant and you're having this irregular bleeding, that could just be a side effect of the emergency contraception, or it could be a sign of something that's going wrong with the pregnancy that would need to be taken care of. So Ulipristal is a newer emergency contraception that always requires a prescription. The Plan B you can get over the counter. But the Ulipristal, or Ella is the brand name, that can be used up to 5 days after unprotected intercourse, and it can actually it can disrupt an implanted pregnancy, whereas the levonorgestrel is not likely to do that. It may prevent implantation, but the Ella definitely can prevent implantation. Does that make sense? This is how they work. If it's taken before the woman has ovulated, that's when the Plan B is really about the only time that the Plan B is effective, because it will cause a delay in ovulation. If it's taken after ovulation, it may thicken the cervical mucus, like we talked about, and it may prevent implantation of an already fertilized egg as well. So this is where the controversy, sort of the ethical controversy, comes up with a lot of these medications. Since a fertilized egg is a new, unique human life, different people are going to have different ethical comfort levels with doing something that could disrupt that. So that's why sometimes that's why there's controversy about emergency contraception. The biggest controversy is that we don't know exactly how it works all the time. Same thing with some of these IUDs. So there's a lot of debate about it. Okay, abstinence is avoiding sexual intercourse, avoiding any activity that can cause the man's sperm to get inside the woman's vagina that could lead to pregnancy. If no action like that ever happens, that's a 100% effective way of preventing pregnancy. Also, abstinence avoiding sexual intercourse will decrease the risk of sexually transmitted infections, but although you have to avoid all sexual contact to really avoid sexually transmitted infections 100%. For example, oral sex is something that can very easily transmit herpes, and possibly things like chlamydia and gonorrhea, and probably HPV as well. Even though you can't get pregnant, you can still get those sexually transmitted infections from oral sex. Anal sex, you can definitely get sexually transmitted infections from anal sex. So those things that are safe from pregnancy don't necessarily mean they're safe from infections. So anytime your genitals come in contact with anybody else's genitals or other warm body surfaces, that's when these diseases can be transmitted. Okay. All right, so there's just the sources I used, and that is the end of the contraception part of things. So tried to go through that faster with you guys, but maybe not. So what questions do you have?
All right, I'm probably going to have some repeats. I'll probably do a lot of repeating from first block between this class and first block, because I think some of those questions in first block are valuable for these kids to hear as well.
Okay.
Just so that you guys all know out there, there are maybe still cards out there. If you have a question from the workshop today, or something's come up in your mind today and you didn't turn it in, please feel free to write it down and just set it on the desk here, okay? Because we want them answered. Or does anyone, I can ask right now, does anyone have a question that you just want to ask? Yep, I didn't think so. Okay. Why? But they had it. Okay, why are there so many kinds? Okay, I'm not too sure I understand this one. Why are there so many kinds if they're supposed to do the same thing? That's actually a really good question.
Oh, different kinds of birth control?
Yeah, must be.
Okay, so they do the same thing, but I mean, people would choose different methods of birth control for various different reasons. I mean, certainly there are medical reasons that it would be unsafe to do certain types of birth control. Like I said, if you have had a stroke or if you smoke cigarettes and you're over 35, those are reasons we would not give you estrogen. So any of the birth control methods that have estrogen in them, we wouldn't use. A lot of it has to do with sort of what a woman's goals are and what she is comfortable using and what kind of fits with her lifestyle as far as which things she chooses. So that's why there's different choices, I'd say. And as far as within the birth control pill realm, there's just a ton of different brands and different generics. I mean, estrogen is pretty much the same, but there's different doses, higher and lower doses of estrogen. And then there's different progesterones. And the goal of all those different ones is to just try to find things that cause the least side effects, you know, that women are the happiest with. And the reason there's so many of them, because a lot of people use them. So there's a lot of money in making birth control pills. So different companies keep trying to make better ones, but there's not any one, particular pill or brand of pill that always works for everybody and another one doesn't, or else that would be the only one they'd make, of course.
Yeah, and think of birth control as options. What option would you prefer? And
Yeah.
you got it great with your lifestyle or what your comfort level. Okay.
Yeah, absolutely. I mean, I talk to women all the time, that taking a pill every day is no big deal. They take other pills. They'd be happy to just take a pill. And they're like, put something inside my vagina? No way. And then I talk to other people that are like, I could never remember a pill every day, but sure, if I just put that in once a month, it's just, some people say the patch irritates their skin and so they don't want to, so it just really varies. An IUD, it's an uncomfortable procedure in the office if you haven't had a baby, and it's, especially if you haven't had sex, having an IUD put in would be super uncomfortable. So some people just don't want to do a procedure. So just different options for different people.
Okay, this one says, I know that birth control can help with other things too. I heard that someone who used birth control to regulate their period, but they had it for months. Why?
So I assume what she's saying, or this person is saying that they had their period for months. So we use birth control the birth control pills as a way of regulating periods when women are having really heavy periods or really infrequent periods or too frequent of periods. All of those are reasons that we use the combination birth control pills to give a predictable period and to just prevent some health problems down the road. But one of the side effects of the pill, especially if you're late to take it or if you miss pills or even just in the first couple months that you're on it, is that you can get some irregular bleeding just kind of as a side effect of the pill. So sometimes people will spot all month long or have a period that just goes on, and we just have to kind of work with the adjusting the medication for that, or looking into if there's some other reason, some polyp or something there that needs to be removed that's causing the extra bleeding.
That kind of leads into the next question here. It says, when you take birth control to regulate your periods, what happens when you just stop taking it? Are there side effects?
Sure. Yeah, so you can, whenever you're done, whenever you stop taking a birth control pill, you don't have to wean off of it gradually or anything. You can stop it whenever you want, but as soon as you stop it, it stops working. It stops regulating your periods and it stops doing anything to prevent pregnancy as soon as it's done. So you'd go back to whatever your periods normally would be, and you'd go back to being able to get pregnant if you had sex.
If you are sexually active, usually how effective is it? So you kind of went over that. Am I correct? The effective of each type of birth control? Yep. Okay. That's what
so I remind you again, in common use, birth control pill is usually about, 90 to 95% effective is probably a good rule of thumb, but remember that's per year. So if you think about most of you guys are like 15 years old, 15, 16?
Mm-hmm.
That way, okay. So if you're 15 and you think maybe you might want to have a baby by the time you're like 25 or 30 or whatever you think, if you started having sex now, that'd be 10 years that you would have, 10 years that you'd be exposed to pregnancy before you want to get pregnant, which would mean if you have a 95% effective thing, 5%, 1 in 20. You'd have a 50% chance of getting pregnant sometime in those 10 years. If you take 5% kind of each year, honestly.
Okay. Is it true that birth control can really mess with the female body?
Well, it depends on what birth control you're talking about. So birth control pills will change things about your periods as far as change that body. That's pretty quickly reversible. So when you stop a pill, you'll go back to whatever your normal periods were, whether that's a normal predictable period or whether that's irregular because you have irregular periods for some other reason. The birth control shot called DepoProvera, that's probably the thing that kind of lingers in your system the longest. So even because it's a long acting shot that lasts for 3 months, but if you've been getting it for a year or 2 years, I've certainly had patients where it takes 6 months to a year before their periods come back after stopping the Depo shots. So that one kind of can have some longer term lingering effects like that. But in general, the long-term health risks of birth control are not, there aren't a lot of long-term risks to it. As far as I go, I hear the question a lot in the office of, if I take birth control for a long time, then will it make me infertile? Like, will I not be able to get pregnant when I want to? And none of the birth control methods do that directly. They just make you older when you're ready to get pregnant, which, you're less fertile when you're 30 than you are when you're 20. And you're even less fertile when you're 35 and when you're 40. The other thing about birth control pills is if you take birth control pills for a long time and have a lot of different sexual partners during that time, and you get sexually transmitted infections, certainly infections like chlamydia and gonorrhea are highly associated with making it harder for you to get pregnant in the future because they can cause scarring of your tubes. So the birth control doesn't directly have long-term damage to your fertility or to your health risks overall, but but it can delay that, or indirect effects like you take it for 20 years and then you're older, so you're less fertile, or you take it for 20 years and you have a whole bunch of partners and then you've had a bunch of infections.
Okay. Why did they discontinue male birth control?
I don't know the answer to that question. There's never really been enough that I know of. I don't think there's ever been a widely distributed medical male birth control available. Although I think there is one in the works now or something.
Yeah, that's right. I thought that too, but
yeah. So condoms are used by men and women, or kind of both. And vasectomies, of course, have always been available to men. The short answer is men aren't as motivated to use birth control as women, just because that's the way the world is right now. The pregnancy is something that's a lot more kind of in the woman's, it's more up to her. That's maybe not the way it should be, because they're both equally involved with getting the pregnancy there. But I think there is some research in the works with male type of birth controls, but I think the way it's been is women have more at stake and more to lose, so they've been more motivated to kind of take charge of the contraception.
Yeah, they carry the baby, so guys don't think
Right.
it was not a push for guys then. We know how Bertha. What are dental dams?
Oh, see, you gave me a chance. I looked it up since our last talk. So 2 things that I didn't include in there, and I can actually share pictures here from my screen. You guys are still seeing my screen, right?
Yes.
Okay. So a dental dam is like this. This picture over here, it's like the reason I got that name is because they use it at the dentist's office. So it's a latex, it's just a sheet of latex that's used to cover the mouth. In the context of preventing sexually transmitted infections, the dental dam is used for oral sex, and you put it between the mouth and the genital area so that the saliva and the secretions don't mix, and it decreases the chance of transmitting infections. So it's not really something that affects pregnancy, because you wouldn't use it with something that could cause pregnancy, but it's used more for oral sex and that kind of stuff.
Okay.
And then similarly, the female condom is kind of the same thing. It's latex, but the female condom is just a little more complicated. It's got these 2 rings here, and you have to like, twist the ring, put the one ring inside, and then it kind of pops open inside, and the other ring is just a little bit outside the woman's body. So it's just, this is the shape of what the condom would look like when it's unfolded inside the vagina. So those are not something that I hear about being used very often, but they are just another kind of barrier to both pregnancy and infection, decreasing your risk of infection.
Okay. I think we kind of pretty much already answered this. Is it a thing that birth control wouldn't work? And it's how you use it, are you using it correctly?
Sure. Yep, absolutely.
I'm not too sure what this is exactly asking, but what things can affect birth control? Oh,
like what medications and stuff?
Must be, yeah.
Okay.
Let's say does, I think I asked it in the other class as well, does any type of like, antidepressants or diabetes affect the birth control if taking such?
Sure. Yeah, I don't think any of the diabetes medications do. A couple of most common medications that can affect birth control are antibiotics. I mean, things that would be most commonly taken. So a couple of antibiotics like Keflex, which is given sometimes for bladder infections or for other skin infections, can make birth control pills a little bit less effective. And doxycycline, which is another antibiotic, has been shown can make the birth control pills a little bit less effective. So just know if you're taking an antibiotic, it's not a bad idea to use a backup method, use condoms for that, couple of weeks after you finish the antibiotics, or don't have sex for that couple of weeks afterwards if you really don't want to be pregnant. The other a couple of seizure medications, so actually several of the older seizure medications, like given to people that have epilepsy, interact with birth control pills and make them less effective. Or also, actually, you did say depression. One of those medicines is sometimes used for chronic headaches or for bipolar. And so that's a medication that can interact with the birth control pills. So it's something, if you're on medications, always ask the doctor that's giving you your medicine. If you're also taking birth control pills, make sure you ask if that's something that can interact to make the pill less effective.
Yeah. And can a birth control make you more depressed?
Sometimes it does. So I mentioned the DepoProvera shot is something that I think more than other hormones can tend to worsen depression. The way hormones interact with people's mood is very different. As you guys probably all know, anyone in the room who's ever lived in the same house with a woman or had a friend or sister or mother or is a woman knows that, different hormones affect different women differently. So some women have really pronounced mood changes around the PMS time, like the few days before their period starts. They get really depressed, they get really anxious, or they get really irritable or really sad. And some women, they don't feel any different during those days. Same thing is true with the kind of artificial hormones we use in birth control pills. I'll find some women just feel horrible. They feel real moody and just not themselves on birth control hormones. And then some people feel much better on the hormones because it helps correct kind of the PMS feelings that they feel naturally without the hormones. So it really varies, but definitely know there can be mood effects. So if you start a new hormonal medication and just kind of find out you're just not feeling yourself and you're kind of crabby all the time or feeling real moody, follow up with your provider about that and see if something needs to be changed.
Okay. This is kind of broad. I think I know the angle, but I'll let you decide on that. What is the safest way to have sex?
Well, it depends on what you mean by safe. If you mean safe as far as preventing pregnancy, and you mean safe, and it depends on what you mean by have sex, I guess. If you're calling sex intercourse, vaginal intercourse with a penis inside of a vagina, that can always put you at risk for pregnancy. That can always lead to pregnancy. the way you prevent that would be all these things we just talked about: pills, condoms, patches, IUD, with their various level of effectiveness for preventing pregnancy. As far as like, if you're asking the question of like what position you have sex in or things like that affecting your fertility, it doesn't matter. Your highest chances of getting pregnant are in those 2 or 3 days a month around the time the woman ovulates, but you don't always know exactly which days those are. So, your safest to prevent pregnancy is to avoid those days and to use any of these other methods we talked about, but it doesn't matter. Yeah, like I said, it doesn't matter what position you're in or different things like that. As far as if you're just talking about sex in general, like sexual contact, you can have oral sex and not be worried about pregnancy at all. You can have anal sex and not be worried about pregnancy at all. But for sure, anal sex, meaning like a penis inside the anus, is much more risky for transmitting infections. The vagina is made to stretch and allow like a whole baby to fit through. The anus is not. The rectum and the anus are not designed for that. And so anal intercourse carries, even though it's safe as far as pregnancy, it carries a much higher risk of transmitting infections, of sexually transmitted infections. The HIV transmission rate is much, much higher with anal sex, and also herpes and HPV, all that stuff is a lot more transmitted. Oral sex, same thing, safe from getting pregnant, but any contact between the mouth and the genital organs can transmit herpes or HPV. The virus that causes cold sores in your mouth is the same virus that can cause genital herpes. And again, those things are things that are, herpes and HPV are with you forever. So the best thing is to have, this is what I always tell my patients, the best thing, anytime you're having sex, there could be something from that that's with you for the rest of your life. So you might as well wait until there's somebody that's going to be with you for the rest of your life. And then you've got him and herpes and not just herpes and he's long gone. Or ideally that you don't have herpes at all. But, so that's what I just tell people, whether it's a pregnancy or whether it's an infection, it could be something that's with you for the rest of your life every time that you have sex with someone. And so, think about that before you make that choice to have sex with someone.
Yep, know who you're having sex with. This is a good one. This is a question that it doesn't surprise me, but surprises me that that a male is more worried than a girl. But why, or what if the female says, don't use a condom, but you are not comfortable doing that?
Okay. Well, the short answer to that question is, anything you're not comfortable doing with your body, don't do. And if someone is forcing you to do something you're not comfortable with your body, that's against the law.
Yep.
So tell somebody about that, make that, it's your body. There's way too much at risk. This isn't about like somebody deciding what movie we're going to watch tonight. Like, well, I'd really rather not watch that movie, but since everybody else wants to, okay, I'll go to that movie. What's the worst thing that happened? You like lose 2 hours of your life watching a stupid movie. Like, there's way more at stake with this. This is the only body you've got, and it's going to be with you for the rest of your life, for your future when you want to have kids, for your, you just got to decide what you want to do with your body. And like I said, anybody that's forcing you to do something with your body that you don't want to do, scream, run away, call the police. Like, it's not okay.
Yeah, persuasion. Persuasion is not right.
Right. And don't get talked into it. It's the only body you were given.
And I like that because it goes both ways. Both sexes can be talked into or, pressured into doing something. That's a great example of how the guys, because often I think guys are a little male bashed to a certain extent when it comes to sex, but that right there is an example of a girl pressuring a guy into doing something that doesn't want to do.
Absolutely. I mean, I mentioned it earlier, and it'll be in this next little set of slides, but all of the infections that we've talked about are tend to be more severe and more harmful and have more long-term effects in women's bodies than they do in men's bodies. And actually even your chances of transmitting sex from a man, or transmitting an infection from a man to a woman during sex is greater than the chance of it going from the woman back to the man, just because of, by the way, our bodies are designed. So women, the stakes are higher for women. I would say they have a little bit more to lose, not to mention the whole pregnancy thing, but but the men have risk too. I mean, there's definitely, everybody's at risk.
Okay.
So, yeah.
What is the recommended age to have birth control?
You can have birth control whenever you need it. So if you need it for preventing pregnancy purposes, you want to start using it whenever you start having sex. I use birth control pills to help younger girls with period problems before they're having sex, and that can be done really at any age after puberty if needed, and then can be used all the way up until menopause if there's not any other reason you can't take those.
Okay. And why do we have to have a doctor prescribe birth control?
So a couple of reasons. I mean, some of the things are available without a prescription, like the condoms and the spermicides and things like that. But the medication birth control are things that, I mean, medications have risks and they can interact with your other medicines. They can interact with, you know, people that have a family history of blood clots or strokes. If you're at higher risk for those kind of things, we wouldn't put you on estrogen because it wouldn't be safe. It's also important that along with any contraception that you're also getting the other kind of healthcare you need, like preventing, you know, testing for sexually transmitted infections if you're sexually active, things like that. So it's just something that there's, just like other medications that need a prescription, like antibiotics and things like that. It's good to go through with a physician. The other thing is, well, I guess the emergency contraception is also something that's available without a prescription. And again, it's just important to know what's going on. Anyway, I don't think it's great that emergency contraception is available without a prescription, because I think there's some risks to it being used incorrectly and people not understanding how it works and what's going on. So stuff like that.
Yeah, and then I think I brought up the last class, just that the Plan B, the emergency, is often used with rape victims.
Sure. Yep.
Yeah.
Yep.
Okay, and that is it on the questions, because there's a couple more, but those questions were answered throughout your workshop. So I know you've got a couple more slides to go through here.
Okay. Well, yeah. Well, let me go. So tell me you guys learned, Sherry told me that you learned about 5 different sexually transmitted infections last time with your with the other workshop. Is that right? With
Yeah.
Who can tell me what infections you learned about?
Who can tell her? Someone. What's that? HIV.
HIV.
Come on, guys. Gonorrhea.
Okay.
Syphilis.
Okay.
Chlamydia.
Well, it was on the list yesterday and it was one of mine, but it was pelvic inflammatory.
Yeah, so the ladies talked about 5, and we did an assignment yesterday. They had to do a little bit of research and actually create a cereal box cover. Instead of the nutrition label, they had to give the facts, transmission, how it's transmitted, treatment, and all that. But they had to come up with a name, they got an STD, so they had to come up with a name for their cereal.
Wow, STD cereal. I like it.
So we some of the kids have talked a little bit more about PID, but they've gone through herpes.
Herpes. Did you talk about HPV? Human papillomavirus? Okay.
Yes. That one to me is one of the scariest.
Yeah. Yeah. So I love it. If you guys can do marketing of a STD cereal that people would buy, that's a pretty good marketing challenge.
Oh, we lost you.
Can you hear me?
We can hear you now.
Okay. Yeah. If you could market a cereal that was representing an STD, that'd be a good marketing challenge.
Yes. Well, we are a marketing health class. That's kind of why we.
Hopefully you could market why you wouldn't want that STD or why you would want to prevent it, right? That'd be an easier cereal to swallow.
Well, I have not taken a look at this blog, but First Blog did it 2 days ago, and I have to tell you this one because I thought this was quite a funny one, and number 2, very clever. But This one named their, they had bacterial vaginitis. And so the name was very bacterial vaginitis. And then her slogan was, it'll leave you itching for more. The gross but funny.
Very creative. I love it.
Creative. So, but that is one of the side effects or
Yeah.
symptoms. So
That's great. All right. Well, I'm going to give you just a little bit of information now about condoms. When we talk about slideshow from the beginning. Okay. When we talk about safe sex, safer sex, I know you guys have been hearing about this since, who knows, before you were born, but condoms is always the talk. The way to prevent sexually transmitted infections is to use condoms. And it's true that that is about the best thing that we have out there, except for limiting your exposure to these things. So, but I do want to make sure that you really get a good sense today, if you take nothing else away from this, about what birth control doesn't do and what condoms don't do. Okay, I want you to know what they do, but I also want you to know their limits. Okay, so I'm going to go over that real quick and then hit on a couple more things about the infections. The big thing about condoms, for them to work, you have to use them always, 100% of the time. As often as you use a parachute when you're jumping out at 10,000 feet, always. Using them inconsistently really doesn't decrease your chance. If you kind of use them when you feel like it and you don't use it other times, looking at people over time, you're not any less likely to get sexually transmitted infections or STIs. If you use them inconsistently, it's the same as if you don't use them at all. So consistent and correct use means no slippage, no breakage, like long fingernails can cause a condom to break. Using any oil-based lubricants like Vaseline, Vaseline type, or that stuff that feels like Vaseline will cause the condom material to break down. That obviously will make it ineffective. You have to have the condom on the entire time you're having intercourse, and you have to put it on inside out. So a condom comes rolled up. You saw that in the little package. If you roll it the right way, there's a little opening, a little space at the tip that holds the sperm, or the semen rather. But if you roll it up inside out, then it doesn't have that opening at the end, if that makes sense. So they can go the right way or the wrong way, and it kind of goes on the same and feels the same, but it doesn't do as good of a job of holding the semen in if you put it on inside out. So the other thing to know is that the rate of transmission of sexually transmitted infections is related to the number of times you have intercourse. And it's also related to the number of new partners you have, okay? For example, and different infections have different levels of how contagious they are. So how likely you are to get them with one act of intercourse. For example, HIV, which you learned is the virus that causes AIDS, which is a lifelong, life-threatening illness that you can die from, or you can take a lot of medicine for a lot of your life and be sick from it. It's only transmitted about 1 out of 1,000 times with intercourse, of each time you have intercourse. Gonorrhea, on the other hand, if you have HIV with somebody, if you have sex with somebody that has HIV, on average, it's only about 1 out of 1,000 times that you have sex before you would get HIV. Gonorrhea, on the other hand, if you have sex with somebody that has gonorrhea, you have a 20 to 50% chance of getting the gonorrhea every time you have sex. So if you have a partner that has gonorrhea and you have sex with them 4 or 5 times, you're pretty likely to end up with that gonorrhea. HPV is also super contagious. So human papillomavirus, up to 88% of women will acquire some type of HPV in their lifetime. I mean, and that data is kind of more from before vaccinations, but it's really common and really contagious. And there's tons of different strains of HPV. I'm telling you the numbers about women because that's what I do. That's what I know more off the top of my head. But men get HPV too, of course. All these things come from both partners. So this slide and this little website here I thought was really interesting because it looks at, it looks at the chances of getting a sexually transmitted infection per one time you have heterosexual sex. male, female, vaginal, penile intercourse, each time, what are the chances? If your partner has X, this infection, HIV, HPV, gonorrhea, syphilis, what is your chance of getting that infection from them with each sexual act? The interesting thing about this, like gonorrhea here in the corner is a prime example. For each act of intercourse, a man is about 20% likely to get gonorrhea from a female partner. And the woman is about 60 to 90% likely to get gonorrhea from a male partner. It's just the way your bodies are made. The male parts are on the outside. They're covered by skin that's like we have on the outside of our body. Female genital parts are inside. And so it's just, just not as much of a barrier. And the women's reproductive organs are more at risk for infection. So again, girls, think about this as you're making your decisions about having sex. You've got a lot more at stake here. Draw your line and stick with it because you've got more to lose. And men, women that you care about, you want to protect them from this stuff. So you want to be extra vigilant about getting checked and making sure that this isn't something that you're passing on to your partner because she's more at risk for it than you are. Okay, and then HIV, like I said, it's the disease that condoms do the best job at protecting against. And they provide about an 85% reduction in risk. But remember, the more times you have sex with the exposed person, the more at risk you are. And the other thing to know is that certain other types of STIs, like you mentioned BV, which is sometimes a sexually transmitted infection and sometimes not, sometimes just a vaginal condition that's not really sexually transmitted. But women who have BV are more susceptible for getting HIV. HIV is transmitted at a higher rate when a woman has BV, just because it changes the flora of the vagina, so it's not as protective against HIV. So there's overlap. Having one makes you more at risk for having another one. All right, so now while my computer is thinking, I'm going to, oh my gosh, we're down to 10 minutes. Okay, I'm going to draw a picture for you guys that I sometimes draw for my patients. So you guys can see this. I don't know how focused it is. Maybe I need a marker. Anyway, I'm gonna make a little X here. So if you were in my office and you were thinking about having sex, or if you'd already had sex, I would say this is you. So I ask people this all the time. How many sexual partners have you had? So it's not uncommon for somebody, maybe by the time they graduate from high school, you might say, oh, well, I've had 3 sexual partners. 2 that were long-term boyfriends, 1 I'm not really proud of, but that's my life. So this is you, this is again, I keep using girls for example, because that's what I'm used to talking to. But so if this is a girl and this is the 3 guys that she's had sex with. Well,
can you can't really see it because you're really small.
She's got
okay. Oh, but what if I stop sharing my screen?
There you go.
Is that better?
There you go. Yep.
Okay. So this is you. This is the 3 people you have sex with, before you're 20 or whatever. Okay. So you might think that's not a super promiscuous person. Had a couple of long-term boyfriends, and then this thing that happened at a party that she's kind of embarrassed about, but there we go. So 3 partners, right? That's your risk. Well, the problem is the first boyfriend she had, he had just had 1 girlfriend before her. Okay, so there's that partner. But then his old girlfriend, she was kind of promiscuous. So before she was with him, she'd had 5 other partners. Okay, all right. So then this was her first time. Second boyfriend, they'd been dating for a while. She'd already had sex, so it wasn't quite as big of a deal to have sex again with this guy because she kind of liked him more than she had liked that guy anyway. So she had sex with him. This guy, well, he'd had just a couple of partners before her. He'd had about 3 partners. And one of them was his first partner. I mean, she was his first partner. I'm sorry, he was her first partner. I'm losing track of the he's and she's. They were each other's first partner, so there's no other exposures. But then his second partner, she'd had a couple before him. And this one, again, this was kind of at a party and somebody that just sort of had a lot of partners. So she had like 6 partners before him. Okay. So that's her 2 regular boyfriends, long-term relationships, 2 pretty steady partners. That's a pretty reasonable thing, right? And then now she's already at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19 people that she's been exposed to from these 2 like long-term boyfriend partners. Then, not to mention, maybe her first week at college or something, there's a party and there's somebody and they get too drunk and they're not really thinking about what's going on and she has sex with him. Well, come to find out, he's had like 5, maybe 7 partners before her, and each of them had about 3 partners. So now she's up to like 50 people that she's been exposed to.
What do you mean by exposed to? Can you explain that a little bit?
Yeah. So when you say you've had 3 partners, what this girl here has really had is she's had about 55 different people whose infections that they have had could be passed on to her.
Even though she didn't have sex with them, but because
Even though she didn't have sex with them, she had sex with somebody who had sex with them, who had sex with them. Okay? Obviously, you can only get pregnant from the person you're having sex with directly, but all these other infections can stick around and linger, and you don't have symptoms from them, and so you keep having more partners and you don't even know you're passing the infections, not to mention things like herpes that are kind of there all the time, or HPV that are there all the time that can get passed along. So, you know, you can use condoms and you can be half as likely to get a sexually transmitted infection, but wouldn't you think it'd be better to just like only do this instead of doing all this and using condoms?
Yep.
So, you know, do you want to get in a car with a drunk driver? No. You could wear a seatbelt, but you just don't want to get in a car with a drunk driver, right? So you got to think about condoms that same way. You guys are sitting there wearing masks, you're wiping down the tables, you're trying to do everything you can to prevent COVID, but like people in Niles have COVID, right? It still happens. So you got to think about sexually transmitted infections the same way. Lifelong consequences, whether it's pregnancy or whether it's an infection, and condoms are going to make those numbers less. So it's good to use condoms every single time you have sex. But the best thing is to have one partner who's only having sex with you, you know, ideally for your whole life. Okay. Hang on. Was there any? I think we already talked about this. Chlamydia and gonorrhea, 50% use. Trichomonas, HPV. Yeah. So the safest sex, limiting your number of sexual partners, and limiting the number of times. So the other thing that tells me too is that if this is your story, if this is you, you get to decide where you're at right now. You get to decide where you go moving forward. Like just because you've had sex, just because you've had a couple of partners, doesn't mean it's just okay to go have 20 more. Because every time is a starting over and is a new chance. Every time you have sex, you're exposing yourself to risks of these infections. So every time you choose not to have sex, you're choosing not to expose yourself to the risk of that infection. And it's a choice that's going to affect you, not just today, but for years and years to come.